Welcome back, doctor. Let us start by our case in neurology. 78 years old man is brought to the physician due to recurrent falls. According to his daughter, he has lost his balance and fallen several times over the past 6 months. He didn't sustain any serious injury. She has also noticed some shaking of the right hand. The patient takes amlodipine for hypertension, lansoprazole for heartburn. He has lived alone since his wife died 5 years ago, but his daughter helps him with shopping and managing the household. Blood pressure 140 over 68 millimeter mercury. Pulse is 72 beat per minute. Neurological examination reveals mild rigidity, limb muscle of the limb muscle, and shuffling gait. Which of the following side effects may be expected early after initiation of levodopa-carbidopa? This is a classic scenario for Parkinsonism, in which the patient has restricted unilateral shaking of the hand, tremors, resting tremor, which later on become bilateral, and patient has on exam has rigidity and short steppage gait or shuffling gait, and recurrent fall due to postural instability and some sort of bradykinesia. This is a classic picture of Parkinsonism. He asks you about what is the initial side effect of levodopa-carbidopa. Levodopa-carbidopa is the precursor of dopamine precursor, which is the initial medication for anti-Parkinsonism. And the initial side effect is hallucination, confusion, like this. So this is the answer. Choreo dyskinesia and dystonia occur late, after maybe 5 to 10 years from using this cinemet or levodopa-carbidopa. Levodopa-reticularity, it is a common side effect in by using this amantadine. Involuntary movement, this can occur early in entacapone or COMT inhibitor. Urinary in retention, this can occur with anticholinergic drug like benzotropine. This is urinary retention. So the correct answer is hallucination. So this is the final concept. Initiation of levodopa-carbidopa can cause hallucination. Choreiform dyskinesia, the late side effect of levodopa-carbidopa, can occur 5 up to 10 years from the using of this levodopa-carbidopa. And levodoreticularis, it is the side effect of amantadine. Involuntary movement early with entacapone or telcapone, COMT inhibitor. Urinary retention, it is a side effect of benzotropine. Urinary retention, dry mouth, like this. So this is a summary. Levodopa-carbidopa is dopamine precursor. The most important is hallucination as initiation. Dyskinesia is late. Anticholinergic cause urinary retention and constipation, blurring of vision, dry mouth. Amantadine, levodoreticularis, and ankle edema. Very important, coming in question always. Dopamine agonist like bromocriptine, pramipexole, apomorphine cause hallucination, somnolence, hypotension. COMT inhibitor, entacapone, cause dyskinesia and this abnormal involuntary movement and this early. And this serotonin is MAO-B inhibitor, insomnia. So you should remember always this Parkinsonian tremor. Resting tremor, and start unilateral, start in one hand and later in the other hand, bilateral, or rest of the body. And the differential diagnosis is essential tremor, and can affect jaw, face, with tongue and limb. And the other associated feature is rigidity, bradykinesia, postural instability. The treatment for the tremor is anticholinergic, benzotropine, trihexyphenidyl, and this cause urine retention, dry mouth, always like this. Trihexyphenidyl typically used in young patient where the tremor is predominant. Why he said young? Because no prostatic hyperplasia, no urine retention, okay, and it can cause dry mouth. So this is a classic picture of Parkinson disease. Rigidity, and the rigidity is lead pipe or cogwheel. Rigidity, not spasticity. Rigidity is extrapyramidal. Spasticity is pyramidal. Bradykinesia. Bradykinesia is bradykinesia. Narrow, base, hypokinetic, shuffling gait. Tremor, resting tremor. Start unilateral, then bilateral. Can affect the jaw, can affect the tongue. What are the forms of bradykinesia? Bradykinesia, it is problem, difficulty in initiation of movement. The patient, when he get up from the chair, difficulty. When turning in bed, difficulty. When start walking, difficulty. Narrowing base, micrographia, coming in question, micrographia, small handwriting, and already hypophonia, soft speech, monotonous speech, always coming. Postural instability result in recurrent falls, as in our case, loss of balance during tumbling or stopping, flexed axial posture, gorilla-like,